Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Greetings. This is David Merck with Axxess and Home Health Gold. Let's look at how the clinical, operational, and financial dashboards are organized. We'll look at the top of the financial page first. The first thing you will see is a note in the upper right telling you which data has been selected for the charts below. These selections can be altered using the drop-down options on the left of the page. You can select a particular branch or group of branches, or you can alter the selections for payers, case managers, or referrals. On the right, you can adjust the time period to track changes on a quarterly, monthly, weekly, or daily basis, and you can vary the report year. Next, you will see the scorecard on the left. In this case, it shows each of the measures on the financial page. It shows the value for the latest period and how much that has changed compared to the prior period. For each of these, you have the percentage of change. Note the arrow next to each item, showing you whether the item measured has increased or decreased. Now look around the page. For each measure shown, there will be a line graph showing performance for the 4 trailing periods, or a bar chart showing 4 different categories measured. For example, accounts receivable is shown with 4 bars, each of which represents a different period of aging. Now move your pointer over the page and note the various items that are displayed. If the pointer is over a light bulb, the method for calculating the related metric will appear. If it is over a bar or one of the points on a graph, you will see information related to that measure. If your pointer hovers over a percentage on a graph, the message will tell you the numerator and denominator used in the calculation. Let's look at discharges within 30 days of admission. If the message showed that the percentage of 28 was obtained by dividing 58 by 207, it would mean that there were 58 patients discharged within 30 days out of a total of 207 discharges. Now suppose you want to know who they are. Click on the number shown on the graph for the period of interest, or click on the dot next to it. A detailed report will appear showing you the patients and an array of information related to the issue. Wherever data is displayed at the patient level, we include the patient's branch, case manager, and payer type. For many columns on the detail reports, you can sort the rows by selecting a small control at the top of the column. This will produce an alphanumeric sort, allowing you, for example, to group records within the report by branch or case manager. And for those of you who are already very comfortable massaging your data in an Excel environment, you can click the download option at the top of the screen. A small window will offer a crosstab option. Choose that, and another small window will emerge. Choose the detail file and click download, and a message at the bottom of your screen will give you a link to the data within an Excel window. You then have great freedom in studying your data. When you finish with one of the domain dashboards, use the navigation at the top to move on to the next. Thank you.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.